My name is Jane Wales. I'm co-founder of Meningitis Now. The original charity that I was the founder member of was called the Meningitis Trust. That was in 1986. The reason the charity was formed was because my eldest son, Daniel, who was then 2.5, developed HIV meningitis. And at that time there was no other charity, no other organisation that actually could offer support or help in any shape or form to parents like ourselves. A very ordinary beginning, I suppose, to the story is that Dan was 2.5 years old, normally a very healthy, active little boy. It was near Christmas, in fact 2 weeks before Christmas, and he suddenly became ill. The suddenness of it alerted me to something not being quite right, even though I was a first-time mum, I didn't really know what it was. There'd been a couple of outbreaks of meningitis in the area, but we hadn't really known about them. I called the doctor, and unfortunately, it was a Friday evening, which is when usually children do decide to get sick as soon as the doctor's surgeries are shut. But he did come out and examine him and said he thought it was a virus. During the weekend, Daniel's condition deteriorated, and the doctor came out again on the Monday morning. I still wasn't happy. He'd gone downhill quite a lot, even though the doctor still didn't pick up any signs of meningitis at that stage. By the evening, he'd considerably deteriorated, so I called the doctor back again. So that was actually for us 3 days and 3 doctor's visits before Daniel got admitted to hospital. It was very distressing, obviously, in the first few days when he was in intensive care, and they told us that he had HIV meningitis, which is a common form of meningitis in the under 5s. The next 2 weeks were, pretty full on. We had a 6-month-old baby daughter. We spent all our time in the hospital, but unfortunately couldn't stay there in the evenings. So that caused Daniel distress and also ourselves. The fact there was no one else to talk to and there was nobody that could give us any positive outcome to what might happen was also very frustrating and very worrying for us. Eventually on Christmas Eve we decided to bring Daniel home. He had his antibiotics. He couldn't walk. There was obviously a problem, a neurological problem, but nobody really knew what it was. And they said, he's got the antibiotics, there's nothing much more we can do, and it's just going to be a matter of time. Unfortunately, this carried on. He couldn't sit in a chair. We had to strap him in. He couldn't walk. He was very slow. He was very tired, and he was a very different child to the one that we had known 4 months earlier. At that time, there had been a couple of other cases. We read in the local newspaper about them, and the local health authority had said that there was no need for concern. And obviously, to us, that was red rag to a bull, because we were very concerned and we were still very much in the dark about Daniel's prognosis. I took it upon myself to write to editor of Stroud News and Journal, who then asked if we could have a front page spread with it, because they felt the story was very powerful and people should know that actually there had been several cases in Stroud Valleys and it was in fact something to worry about for parents. And that was in March 1985. And from then on, really, things took off fairly quickly, in that the local and national press got involved, and then national TV got involved, because obviously they realised that there was something going on. It did look a little bit like a cover-up, and they wanted to know more, and so did we. From then on, we formed a small support group, Stroud Meningitis Trust, and we were basically a campaigning group, firstly to get the awareness out, to tell people what exactly the disease was, what the signs and symptoms were, because there was panic in the valleys. People were obviously very worried when members of their family became ill, and they were flooding the doctor's surgeries. People wouldn't swim with our swimming gala. Houses weren't being sold in the Stroud area. So it was becoming a little bit hysterical, and it didn't need to be, because we were saying it was the fear of the unknown, not the actual, disease itself. And so we very much campaigned with the local environmental health officer to get some information out. And in those days it was the rent rates rebates, and a little pink leaflet came out from Meningitis Trust and the Health Authority explaining and outlining the details of the disease, signs and symptoms, what to look for and what to do. And that was a huge help. That really did help people. Sadly, a little bit later, a young child died in Stonehouse, and that caused another uproar in the community because people felt enough wasn't being done. So there was a big study done. There was a public meeting, and as a result from the public meeting, it was said that, if you don't know enough about the disease, come to Stroud and find out what you don't know, and try and make this into a positive thing if we possibly can. That turned out to be a huge, huge success. It's the biggest and the only survey of its kind ever done in the world. And from that information came the vaccines that we're still using today. So it was a very, very important shift in history for meningitis. Along with the research side of things and the awareness side of things, obviously we needed to support other people. In setting up the charity, I could speak to other people in a funny sort of way. It also supported me because our family then realised we weren't alone. There were lots of other cases, and we could talk to people who were further on from us. So it gave us some kind of hope, and basically that's all we did have, because at that time the medical authorities really didn't know a lot about the after effects. There was even talk that there weren't after effects. If you'd recovered, then you were fine, and we very much began to realise that was not true. Sadly, there were a lot of deaths because the diagnoses weren't being picked up quickly enough. So we worked very hard in getting information out about signs and symptoms, the speed of the illness, and the fact that parents must act quickly and doctors must act quickly. I then did surveys with GPs to ask them how they felt about it, and most of them said they were terrified at missing a case. We worked then with the health professionals in a diagnostic system so that they again could, once the child was admitted to hospital, then that cases weren't missed and the appropriate action was taken. So therefore lives were being saved straight away. And we set up as a very small community group, and then obviously it became a very national problem, something that we weren't really expecting. We found out that obviously Stroud wasn't the only place that had cases of meningitis. There had been an outbreak in Plymouth a few years before, but they'd kept it very quiet. And other places now were starting to experience outbreaks. It became obvious it was a national problem and we would have to become a national charity. Not something that I'd actually ever planned to do, I have to say, but the need was there, and it was our moral obligation really, and our duty to help all of those people out there that, like us, were suffering and needed to just have somebody to listen to them and to help them. We set up 24-hour helplines, 365 days a year. We continue to support research projects. We've set up a research panel, and obviously our awareness campaign was very, very much paramount so that we could alert people all over the country. It really grew and grew and grew. We became a national charity in 1986, and we took on a small house just up the road from where we are now in Stroud, called Fern House, which was given to us by our landlord. He has supported us ever since. It was an amazing move because I was running it from my home 24/7, and obviously our family was buckling under the pressure of that too. By Howard Bailey giving us that small building, it meant that we could move and become a professional organisation. We could start employing people. We had press officer. We were very small. We actually, often people had multi-roles. But we were going to London, we were campaigning, we were getting ourselves noticed, and we were growing very rapidly. So the need was there and we were just responding to it. And I think in the first 5 years, that's all we did. We responded to the crises that were happening. And then after that, we could start planning what if we can get this vaccine, how about the promotions of that. We worked then with universities because we realised that it wasn't just babies that got the illness. Another group of vulnerable people were the 15 to 24-year-olds. And that was because of obviously they're, going through puberty. A lot of them are being much more sociable, moving in different sociable circles, going to university, moving out the area, mixing with different bacteria. And so we campaigned hard for that. And then we did an adult campaign also, because unbeknown to lots of people, anyone of any age can get meningitis, and particularly vulnerable then is the older age group, because again their immune systems are going down and sometimes maybe they've had spleens removed or they've got other underlying illnesses. So we wanted to, make people realise it could happen to anyone. The fantastic news is that obviously Hib was introduced in 1992, so then 98% of cases of Hib was actually eradicated in 2 years. And then in 1997 we got the meningococcal C vaccine. Meningococcal C was responsible for a lot of outbreaks in universities and young people. The uptake of that was obviously very good. And again, the success rate for that was in the 90% or more in the first 2 years. In 2015, we have got the bee vaccine, which is the vaccine that we've been chasing really right from the very beginning. In 1986, that was our goal, that we could get the vaccine. That the disease has been notifiable since 1912 and not much progress has been made. So when you think that actually in 30 years we've got 3 very important vaccines, as well as improving the vaccines for pneumococcal and the different other strains that you can get, I think we've done a fantastic job, and we have still a lot of work to do, but at least we have a lot of successes to celebrate.